Hi, my name is Niku Kuzungu. I'm an intern psychologist from Student Counseling and Health. Today's topic will be on substance abuse. Substance abuse can be defined as the use of illegal drugs or the use of prescription or over-the-counter drugs or alcohol for the purposes other than those for which they are meant to be used or in excessive amounts. Substance abuse may lead to social, physical, emotional, and job-related problems. Clarity of substance abuse versus addiction. Substance abuse, by definition, relates more to how individuals use drugs or alcohol. They use them inappropriately. Anytime an individual uses illicit drugs or using a prescription drug outside the perimeters of the prescription, it is termed substance abuse. Addiction, however, involves negative physical and psychological effects that the continued substance abuse brings. When individuals become addicted, it becomes near impossible for them to stop using drugs or alcohol, unlike those who, for example, participate in binge drinking or occasional drug abuse. When it comes to substance abuse, a person exhibits one or more of the following symptoms over a 12-month period. Firstly, performance at work, school, university suffers as a result of drug or alcohol use. Secondly, they take part in reckless behavior associated with the use of drugs or alcohol that endangers their safety as well as the safety of others. Thirdly, they continue to use the substance even though it is causing stress and strain on personal relationships. And lastly, they have legal problems, financial problems, or problems with the police as a result of their alcohol or drug use. Now, there are different types of substance abuse, starting with legal substances, which contain opioid pain relievers, medicine used to treat attention deficit hyperactivity disorder, anxiety and sleep medicines, cough medicines, and there are illegal substances, which consist of heroin, alcohol, crystal methamphetamines, cocaine, marijuana, and cigarettes. Now, there are different signs of substance abuse one could look out for, starting from behavioral changes, which consist of increased aggression or irritability or erratic behavior, changes in attitude or personality, lethargy, depression. One could also look at the messages that they post, big changes in habits and priorities, criminal activities, slurred speech, and isolation, which consist of staying long periods in their room or locking the door, not sharing details of their whereabouts, shutting down, etc. There's also frequent sniffing and changes in sleeping patterns. There are also physical symptoms, which consist of bloodshot or glazed eyes, dilated or constricted pupils, abrupt weight changes, whether they lose or they gain weight, hygiene problems, which consist of body odor, looking untidy, etc., poor physical coordination, persistent itching, impulsive pulling down of sleeves to hide marks. Now, if you have a family member who uses substance abuse, one could look for equipment such as cigarette wrapping papers, pipes, syringes, rolled up banknotes, cut up straws, soiled cotton swabs, lighters, burnt spoons or bottle caps, bongs, razor blades, cutting surfaces like mirrors or glass, and also finding multiple empty medicine bottles. If you are struggling with substance abuse, one could reach out to multiple toll-free lines. You can speak to someone you trust. There's Students Counseling and Health, there's SANCA, there's Careline Crisis Center, there's Narcotics Anonymous meetings, there is KwaZulu Natali support groups for males and females. There's the South African Depression and Anxiety Group, formerly known as SADAG. There's the Trauma Center, which provides counseling which has a number that one could reach out to and also an email. There's the human trafficking helpline, which there are also multiple numbers that one could call. There's Akeso, which has a 24-hour emergency contact number. There's the Former Dynamics Police and Trauma Line, which also one could call. If you're a student at DUT, there is DUT Student Counseling and Health, which is located on Steve Biko campus on the lower library level. There's a team of psychologists who are there to assist you with various difficulties that you might be experiencing, from personal difficulties such as anxiety and depression. If you need career counseling and career assessments, that's also provided at Student Counseling and Health. When you want to book an appointment, because of COVID, the appointments are online, so we do have appointments through MS Teams. All information within the sessions remains confidential. To make an appointment, please send an email to countsbooking@dut.ac.za. If you're at PMB, it's countsbookingpmb@dut.ac.za.